name's Abby Cannon, and this is a HEENT midterm video. Hi, Tamika. I'm Abby, and I'll be your nurse practitioner today.
Nice to meet you.
You too. Do you mind if I do a quick head, ears, eyes, nose, and throat exam on you?
Not at all.
Okay, thank you. Let me know if anything hurts or makes you feel uncomfortable.
Okay.
So first, I'm just gonna do you mind if I touch? I'm just gonna look at your scalp here. Make sure there's no lesions or tenderness. Kind of separate your hair a little bit. Look in your ears. There's no drainage, no swelling, no asymmetries, no keloids. Alrighty. I'm going to touch your face and I'm going to check your sinuses, okay? So just let me know if anything hurts. Is there any pressure there?
No.
Okay. Perfect. Now if you can go ahead and open and close your jaw 3 times. Thank you. And then I'm going to go ahead and just palpate your temporal arteries here. Perfect. And then I'm going to check your lymph nodes for any swelling. I'm just going to go all around here. Let me know if you're having any tenderness. Perfect. Everything feels good so far. Along your clavicle. Alright, I'm going to go ahead and take a listen now for any brewy or whooshing sounds in your arteries on your face and neck. Perfect. Okay, and now I'm going to check breath sounds up here in your bronchi, so just go ahead and take 2 deep breaths for me. Sounds great. Alrighty, I'm going to go ahead and fill your carotid arteries here one at a time. Okay, feels good. Alright, I'm just going to check and make sure your trachea is nice and midline here and that your thyroid's not enlarged. I'm going to come behind you, and then I'm going to have you lean slightly forward for me into one side, either side. And I'm going to just hook my fingers and do a little swallow for me. Perfect, and to the other side now. Alrighty, thank you. Okay, we're gonna go ahead and do the eyes now. So ideally I would be 20 feet away from you, but this room's not that big. So if you can just go ahead, I'm gonna show that I've got my eye chart here. Go ahead and say as many letters as you can line by line.
You want me to cover?
Yeah, cover one eye, please.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z B D E F P O T E C L E F O D P C T F D P L T C E O P E Z O L C F T D.
Thank you, perfect. Alrighty, we're going to do some vision tests here. So we're going to start with some peripheral vision tests. So I'm going to close my left eye and you close your right eye since we're facing each other. So is anything blurry on me? Are you seeing okay with this eye, the open eye?
Nothing blurry, okay. Seeing clear.
Perfect. So I'm going to just hold up in each quadrant, I'm going to hold up a number and I want you to tell me what that number is in your periphery, okay?
Okay. 1, 2, 5, 5.
Perfect. And now we're going to try the other eye. Go ahead and readjust.
1, 2, 2, 1.
Perfect. Go ahead and readjust, and we're going to close the other eye again, this one. And I want you to tell me when you can see my finger coming into view, okay?
Into view. Into view. Into view. Into view.
Okay, now we're going to do the other side again.
Into view.
Perfect.
Into view. Into view.
And one more.
Into view.
Okay, awesome. Thank you. And now we're going to do something called the cover-uncover test. So I'm just going to look closely into your pupils here, and I want you to cover one of your eyes. You can choose which one first. And I'm just going to check for any abnormal eye movements once you finally uncover. So I'll let you know when to uncover. Okay, go ahead. Perfect. And now we'll do the other side. And go ahead. Awesome, thank you. And now we're going to do some extraocular movements, okay? So I want you to follow my finger, but do not move your head or neck, just your eyes. Perfect, keep on following. All right, awesome. Now I'm gonna bring the light in here. Try to stay at least a foot away from you so it doesn't bother you too much. First, I'm just gonna shine it into both eyes at the same time and check for your corneal light reflex. So whenever you're ready, go ahead and let me know.
Ready.
Okay. All right, perfect. All right, so now I'm just gonna shine it twice into each eye and check that your pupils are reacting appropriately, okay? Perfect. We'll go to the other side. All right, thank you. Perfect. Alrighty, I'm gonna also use my pen light to check to make sure that your sinuses aren't congested. So what I'm gonna do is I'm gonna put it against your cheek, and I want you to open your mouth and tilt up a little bit, and I should be able to see the light shine through. Okay, go ahead and open. Perfect. I'll do the other side here. Alrighty, thank you. Alright, I have to turn down the light now for our ophthalmoscope exam. I'm going to turn that off here once I get my light on. Okay, we okay like this?
Mm-hmm.
Might be a little too dark. Okay, I'm just going to check for a red reflex first. Try to look at my nose beyond the light if you can, so it doesn't hurt you. Okay, now I'm going to get really close to you, okay? I'm going to look kind of behind your retina. Try to keep your eye open as much as you can. Alright, thank you. Check for red reflex. The other eye, you doing okay?
Mm-hmm.
Perfect. And then I'm gonna get real close to you here. Alright, looks good. Thank you. Now I want to assess the inside of your eyelids here. I'm just going to use a little Q-tip. I'm not going to hurt you. Just going to lightly lift up your eyelid here with the Q-tip. Make sure that it's nice and pink. Perfect. You doing okay?
Mm-hmm.
Okay, perfect, thank you. Let's move on to the ears here. So first I just want to do kind of an external exam, which I kind of already did before, but is there any tenderness when I pull or push?
No.
Okay. Perfect, we'll do some hearing. So first I'm going to stand behind you and do what's called a whisper test. So I'm going to stand about a foot or two behind you, and I'm going to whisper 3 words onto your right side and then onto your left. So after each 3, I want you to repeat what I said, okay? So you can go ahead and cover it. Yes, thank you. Baseball, football, soccer.
Baseball, football, soccer.
Perfect. And again over here. Trombone, tuba, sax.
Saxophone,
Saxophone.
tuba.
Let me try again.
Trombone, tuba, saxophone.
Perfect. Alright, I'm going to use my tuning fork here. So I just want you to let me know if you can hear this equally on both sides when I put it on top of your head, okay?
Okay. Yes.
Perfect. Alright, now I want to do a couple other tests. I'm going to put this against your bone here, and I want you to let me know when you cannot hear it anymore. And then I'm going to put it out here, and you let me know when you cannot hear it anymore, okay?
Okay. Cannot hear it. Cannot hear it.
Okay, we're gonna do the other side here.
Cannot hear it. Cannot hear it.
All right, perfect. Thank you. Gonna go ahead and look in your ear with my otoscope here, and then your nose, and then your mouth, and then we should be done with the exam.
Sounds good.
Put a fresh cover on. Tympanic membrane looks good. There's no wax buildup. Alrighty, perfect. Thank you. All right, let's look in your nose. Go ahead and tilt your head up for me. And I want to make sure too that you've got symmetry on both sides, no lumps. Actually, real quick, can you go ahead and occlude one side and take a deep breath? And then repeat on the other side for me. Do they both feel nice and clear?
Mm-hmm.
Okay. Wait, real close to you, sorry. Perfect. All right, let's look in your mouth real quick. I'll grab the tongue depressor. And open. And say ah again. Perfect. And lift your tongue. And put your head down for me so you can see behind your teeth. And up. Look at your cheeks here. Alrighty. Let me make sure there's nothing I missed real quick. Just want to check your gag reflex. I'm going to be gentle here. Go ahead and open. And I'm just going to... Okay, perfect. Thank you. Sorry about that.
You're okay.
All right, well, thank you. We're all done here. Do you have any questions?
No, thank you for your time,
All right.
Abby.